Good afternoon. I'm Victor Valesky, Superintendent of East Brunswick Public Schools. Welcome to Memorial Elementary School, one of our 11 nationally recognized Blue Ribbon schools.
Wow.
With the supportive, thank you. With the supportive Board of Education and alongside talented members of my administrative team, we have navigated, along with Mayor Dr. Cohen and his township administration, each next step in this pandemic using science to maximize the safety of our students and staff, as well as the durability of opening schools for full days of instruction with before and after school care services, breakfast, lunch, extracurricular activities, and athletics. Building on our COVID-19 mitigation success from last school year and continuing into our extended school year program this summer, our response team, representing our district stakeholders, once again relied on science to plan and vet our school reopening protocols for the 2021-2022 school year. Last evening, I shared with our Board of Education members that East Brunswick Public Schools would require masks worn by staff and students while being transported on buses or while in district schools, regardless of vaccination status, as we open our school year. This necessary incremental step, aligned with guidance already provided by the Centers for Disease Control and Prevention, along with the American Academy of Pediatrics, will help ensure our East Brunswick school community safety during periods of spiked variant transmissibility and until vaccinations are available to all our students. Today, it is my honor and privilege to introduce the leader of our great state of New Jersey, the Honorable Governor Philip Murphy. Governor Murphy has been a steadfast supporter of education and is with us today to provide a statewide perspective on the opening of our schools this year. Governor Murphy.
Thank you very much, Doctor. Thank you. Thank you all. Great to be here. Dr. Victor Valesky, I thank you again for hosting us so graciously as superintendent to the East Brunswick School District. And in this school in particular, it's an honor to be here. We are joined by some very important folks this afternoon. Dr. Gene Kraft, who's the president of the New Jersey chapter of the American Academy of Pediatrics. From the Dumont Public Schools up in Bergen County, New Jersey State School Nurses Association President Donna Pluce is in the house. Morris Union Juncture Commission Superintendent and President of the New Jersey Association of School Administrators, Dr. Janet Fike. Great to have you, Janet. And to my right, a dear friend, New Jersey Education Association President Marie Bliston. To all of you, thank you. With us as well, a couple of other folks I want to point out. The woman who needs no introduction is in the front row, Commissioner of the Department of Health, Judy Persichelli. Judy, great to have you. Assemblyman Sterling Stanley. Sterling, great to see you. Steve Beatty from the NJEA. And certainly a guy who knows a thing or two about running government and about medicine. Your mayor, Dr. Brad Cohen, is in the house. And to all the other dignitaries, deep appreciation for being here and for all you do. Together, all of us, we are announcing that due to the recent and rampant spread of the Delta variant, the fact that no child under the age of 12 is yet eligible to be vaccinated, and the reality that too many older students and their parents remain unvaccinated, that all students, educators, staff, and visitors will be required to wear masks inside of school buildings, regardless of vaccination status, for the start of the 2021-2022 academic year. This is not an announcement that gives any of us, or me personally, any pleasure. But as the school year approaches, and with the numbers rapidly increasing, it is the one that we need to make right now. Speaking of numbers, just to give you a little bit of a flavor of just today's numbers, 1,249 more positive tests, with the heaviest of hearts, 7 more confirmed losses of life. There are 619 folks in our hospitals, 105 of whom are in the ICU, and 48 of them are on ventilators. 76 persons went into our hospitals yesterday with COVID. The good news is 78 live patients left. The positivity rate is still too high. It's a little bit better, but it's 4.32%. And the rate of transmission, Judy, last I saw was 1.37, which has come down a little bit, and that's good news, but it's still higher than we need it to be. So I want to be also clear that our schools will open for full-time, in-person instruction, as previously announced. We remain steadfast in the recognition that our children learn better in a classroom setting tailored for their educations. Allow me, if I may, to step back just for a minute. The health and safety of our kids is among, if not my most sacred responsibility, as it is, by the way, for any governor. There are issues that are and must always remain above politics, and this is one of them. Anyone telling you that we can safely reopen our schools without requiring everyone inside to wear a mask is quite simply lying to you, because we can't. I want as much, believe me, as much as anybody else in our state to see our kids' smiles as they start their school years. But I do not want to see at the same time any of them getting sick needlessly, or schools have to shut down again and go remote because of an outbreak, and especially of a dangerous variant that is putting kids in its crosshairs. Absent this requirement, that's exactly where we'll end up. And that's not speculation. If you look to what's already happening elsewhere across the country in schools that have already opened, and they're mostly in the southern part of the country, without a mask requirement, it's not a matter of if we would have a school closing outbreak, but when. For this moment, getting our kids safely back in the classroom requires them and their educators and staff to begin the upcoming school year wearing their masks. Our educational communities lost a lot over the past school year. Remote learning imposed intense challenges on educators trying to reach students without any real way of knowing if they were. It prevented countless students from having the direct connection with their educators that leads to greater success. It placed an undue burden on countless working parents. Remote learning is no replacement for the bond between educator and student, or for the support and socialization that our children receive from being among their peers. We are committed to rebuilding these bonds in the safest way we can. Today, that means following the guidance of the CDC and recommendations from the American Academy of Pediatrics. It means taking to heart the many conversations we've had with medical experts here at home, with school district leaders, with educators, and with key stakeholders, including parents. It means ensuring a layered approach to safety that brings together a host of strategies, including masking, to keep schools safe. And I want to make it clear that as soon as conditions allow, please God, sooner than later, we will lift this requirement again. This is not permanent. And our requirement will have the same common sense carve-outs that were in place for the last school year, including for students with documented medical conditions or disabilities which make wearing a mask either difficult or dangerous, rigorous activities in gym classes, excessive heat, playing a musical instrument, or eating in a classroom or cafeteria. Judy would want me to remind us that we know firsthand how impactful masks are in slowing the spread of this virus and in protecting individuals and in crushing the curves. We are educated by last school year, when the total number of positive cases linked to in-school building activity was 1,263 out of the more than 1 million students and educators and staff who over the course of the year re-entered their schools and classrooms with a requirement to wear a mask. And to help us keep our schools safe, we have nearly $270 million in federal funds set aside for testing that we are ready to work with districts to deploy. And yes, we will be able to get to the point where we can lift this requirement more quickly through continued vaccinations of older students and adults and getting younger students vaccinated once the CDC and FDA make them eligible to receive the vaccines in our toolbox. Here's what the most recent weekly data told us. More than 80% of the people who contracted this virus were unvaccinated. More than 95% of the people who entered our hospitals were unvaccinated. And 100% of the people who lost their lives were unvaccinated. These are the facts, and anyone willfully ignoring them is putting not just their life in danger, but the lives of their loved ones and indeed of many others in their community. We've proven, and Judy's been at the forefront of this every step of the way, that we can mobilize to vaccinate. We did it with our long-term care facilities. We did it with our mega sites. We did it working directly with communities, within communities, and with doctors and pharmacists. That's how we became one of the nation's top states in terms of vaccination and the #1 big state in America in terms of vaccinations. So once the approval of these vaccinations for all school-age children come, we are ready, and Judy, I would add to that, if the decision is made at the federal level that we all need boosters, we're ready for that as well. But again, for the moment, this is where the virus demands us to be. Vigilant against further spread, yet optimistic that this is just a bump in our journey. I'll close with this comment, if I may. Our kids are strong, they are smart, and they are resilient. They've proven that time and time again. And I know they're going to lead the way and maybe even teach a valuable lesson to many of us grown-ups in showing how much they care for their friends, their educators, their families, and their communities. That said, please help me welcome the president of the New Jersey chapter of the American Academy of Pediatrics, Dr. Gene Kraft. Gene, welcome.
Well, earrings and masks are certainly a challenge. Thank you, everyone, for being here. Thank you, Governor Murphy. It's quite an honor to be here, and it's quite an honor to be the president of the New Jersey chapter of the American Academy of Pediatrics. In addition to that, though, I'm a mother, I'm a grandmother, and I'm also a pediatric critical care doctor, meaning that I take care of children who are critically ill or injured in intensive care units. And that includes children with COVID. Even as we sit here today, there are children in the hospital with COVID. Even though they are less affected, it doesn't mean they are not effective. The New Jersey chapter of the American Academy of Pediatrics supports an evidence-based approach to protecting children and communities from the hazards of COVID-19 infection as children re-enter school. Safe re-entry is based on the best scientific evidence and expert guidance available. The most recent school guidance from both the CDC and the American Academy of Pediatrics emphasize both the value of in-person, face-to-face school for the well-being of our children and the value of a layered safety strategy that includes masks to minimize the risk of transmission, serious disease, and even death due to COVID-19. The death count for children from COVID-19 in New Jersey is 7. That may sound small, but that means that there are 7 families that will not see their children grow up. And that is huge to me. Vaccine is an essential tool in fighting this pandemic, and over 5 million of us are fully vaccinated here in New Jersey, but that's not enough yet. It will be enough because the Department of Health and the Commissioner are working very hard to get us to enough, but we are not there yet. Although children over the age of 12 are now eligible for one of the vaccines, those under 12 have no approved vaccine available to them as yet. In addition, a number of adolescents and adults, as you've heard, are still not vaccinated. Recommendations by the CDC and the AAP for universal masking in schools is based on many factors, including the following. Children under 12 are not yet eligible for vaccination, and what this means is that elementary classrooms will be full of unvaccinated children. And some middle school classrooms will also be full of unvaccinated children. Until more adolescents and adults are vaccinated, junior and senior high classrooms will have a mix of vaccinated and unvaccinated individuals. Vaccination is highly effective, particularly in preventing severe disease and death, but it is not 100% foolproof. Infections are rising. The Delta variant of the virus, now the predominant variant spreading, can be transmitted even by vaccinated individuals. This Delta variant, if the stories that I'm hearing from my colleagues in Florida, in Alabama, in Georgia, in Texas, hold any water at all, which I believe they do, this is causing more severe disease in children, and their pediatric ICUs are filling up with children with COVID. That scares me as an ICU doctor. I would love nothing more than to be put out of business by everyone getting the COVID vaccine. That would please me to no end. Here in New Jersey, we have seen a concerning rise in the spread of the virus. A hopeful spring has become a worrisome summer. The conditions have changed. The risk is higher, especially for children. We need to move forward with an abundance of caution, and I thank the governor and his whole team for making what is no doubt a difficult but absolutely necessary decision regarding masking of children in schools to keep, and administrators and teachers and visitors, everyone in the school, to keep us all safe. We have come so far, but we need to continue to rely on scientific evidence and expert advice to keep children, teachers, school staff, communities as safe as possible. Please get the vaccine if you are eligible. Please mask up, wash your hands, keep a respectful and safe distance outside your own household members, and stay home if you are sick. Thank you for your time.
Thanks, Doctor. Great job. Thank you. Jane, thank you so much for that. Those are all extremely powerful and very good advice, so thank you for your leadership. Please now help me welcome the President of the New Jersey Association of Schools, President Janet Fike. Janet?
He was commenting about my mask, which I'm very proud of. It's the autism puzzle. Thank you. Good afternoon, Governor Murphy, Commissioner Persa Kelly, and Commissioner Alan McMillan. Thank you. And to our state officials, to our honored guests, and to our viewers at home. Today is a great day. Today, all school leaders around the state, I assure you, are drawing a big sigh of relief because the continuing divisiveness about wearing masks in schools has come to a close. We as school leaders can focus on moving forward and planning for full in-person instruction in the best, most possible, and safest way. So Governor Murphy, thank you so much for that today. It is a welcome, welcome message. For the past 3 months, school officials have been pummeled with questions, whether at Board of Education meetings, in community forums, through social media, in parking lots, at Starbucks, of what is your district doing about masking. It has polarized communities. It has taken a real life venue that is quite incredible. Today, hopefully, that is over and we're moving on. I give my heartfelt appreciation to Governor Murphy, to the state officials, to the health and medical personnel in this room and outside this room that serve New Jersey so well, for recognizing that medical decisions must be made by medical personnel. Thank you for that. COVID-19 knows no geographic boundaries. It is irrespective of if one child is masked, the rest are not. Everyone in a school district can become infected. unmasked. It doesn't matter if students are in District A and visit District B, that infection can spread. It doesn't matter if students in Class A in a school are masked and students in Class B are not. That transmission can occur. Today ensures that that won't happen or won't happen easily. So thank you for that, Governor Murphy. COVID-19 is also not respectful of timelines, decisions, or desires. We were in a very different place in June than we are now. And in September, we'll be in a different place. We don't know what it will be, but it will be different. We know that. This year, our school leaders have been masters at developing plans to thwart COVID, assessing those plans, implementing those plans, revising those plans, and retesting those plans, because that's what they had to do, because COVID wasn't predictable. That, I thank Governor Murphy today for his ability to reassess, revise, reevaluate, and reimagine where we need to be in September. That's a very brave position, and we are all so grateful. As my mask indicates, special ed is near and dear to my heart. I am pleased and proud to serve as the superintendent of the Morris Union Jointure Commission, where our population is exclusively children with significant disabilities. This year, I am so proud that with our incredible students and our amazing staff, we started school September 1. We went the whole school year, but we did it thoughtfully and with masks, with our hand washing, with our health and hygiene routines and social distancing. We did it together as a team. We had a good year. Other parents of students with disabilities report other things. A dear friend of mine just this week said to me, "What am I going to do with my child in school next year? The parents in our community do not want masks. My child has to wear a mask because of his disability and his concomitant medical condition." She said, "But he won't wear a mask if other students are not in masks. So what do I do?" And what I say to my dear friend today is, Governor Murphy, you've given that parent her answer. So thank you for that.
Thank you, Jen.
You're welcome. As I conclude, I want to thank everyone in this room who's committed to doing the correct and safe and healthy thing for all of our students, to the medical professionals who've worked so tirelessly this year, and to the governor and to all the state officials who've never wavered in their zeal and compassion to have the health and safety of our students first, by ensuring that we start in the safest possible way, which are with our masks. We can start strong and we can stay safe. And for that, I thank each and every one of you who had a decision-making piece of this action today. So thank you, and we're going to have a great school year. Just you watch.
Thank you, Janet. So well done. Thank you so much. Janet, really, really impressive and so well framed and spoken. Dr. Angelica Allen McMillan, I run the risk that she'll never speak to me again for not having introduced her, our Commissioner of the Department of Education. Angelica, great to have you with us. We had a lot of presidents today, by the way. One governor, one superintendent, and not 1, 2, 3, but 4 presidents. So please help me welcome our next president, another important president, the president of the New Jersey State Nurses Association, President Donna Pluce. Donna? Great to have you again. Thank you.
Hi, good afternoon. As the governor stated, my name is Donna Pluce, and I'm the president of the New Jersey State School Nurses Association. On behalf of the 2,500 school nurses represented by NJSSNA today, thank you for allowing me to speak. School nursing has deep roots in combating communicable diseases. In fact, that's how the first school nurses came to be, and they worked in New York City's public schools starting in 1902. A school nurse was hired to reduce absenteeism by addressing healthcare needs related to these diseases. For almost 120 years, preventing and rooting out communicable diseases has been a core component of school nursing. Universal masking, regardless of vaccination status, is the evidence-based recommendation of the American Academy of Pediatrics and the Centers for Disease Control and Prevention. Studies have shown positive results in masking and decreasing disease spread. In school, in this past year, in addition to low COVID transmission rates, we also saw far fewer cases of flu, strep, and RSV when masking and other mitigation strategies were in full force. We also know that the Delta variant is more transmissible than the original SARS-CoV-2, which causes COVID-19, and thus requires more stringent safeguarding. In a few short days, and I can hear the kids out there groaning, our K-12 school children and staff will return to their classrooms for full-time, in-person instruction. This is a great thing, and it puts us back on the road to normalcy. However, it is our duty to assure that our school communities are kept safe from disease by implementing the safest public health mitigation strategies that have proven effective, including social distancing, proper ventilation, contact tracing, and most importantly, by making sure that universal masking is in place. For school districts to do anything else is unsafe. The public health messaging about masking has been muddled, but the science behind the recommendation is crystal clear. Masks protect students and staff from the invisible virus that's attacking us. The new Delta variant is broadly affecting younger people and children. Vaccines are protective, but since the majority of children are not yet eligible and this new variant is highly transmissible, we must use the few tools that are available to us. The NJSSNA represents certified school nurses in our state who are charged with caring for and protecting the health and safety of 1.28 million children. Implementing universal masking through the surge of the Delta variant is a low-stakes solution to a high-stakes public health crisis. Our school communities deserve to be protected. Thank you, Governor Murphy, for following the science and getting our schools to mask up and be part of the solution to combat this disease. Thank you.
Thank you so much. Great job. Really appreciate you being here. Give my best to my friends at Dumont, by the way. Thank you, Donna. Really, again, really well framed and well said. Last but certainly not least, representing the New Jersey Education Association, the NJEA, a dear friend, a great leader, its president, Marie Bliston.
Good afternoon, everyone. My name is Marie Bliston, and I am a very proud New Jersey classroom teacher of students who have received special education services well over 30 years. I am also a mother and a grandmother, and I stand here very proudly before you as the president of the New Jersey Education Association, representing our 200,000 school employees, and I thank you, Dr. Zaleski and Governor Murphy, for hosting and having us here and allowing me the opportunity to join you in this event. I want to make a point here of thanking Governor Murphy personally for your consistent commitment to following the science and keeping our schools safe, and it has been consistent. This, thankfully, is the leadership that we have in this state right now, and the leadership that we need when I see some putting political posturing ahead of the health, the welfare, and the well-being of our schools and our students. Thank you, Governor Murphy, for standing on principle, but also for doing the right thing. By taking the action today with requiring masking, you have removed the uncertainty for many about the coming school year. But you also have alleviated some of the concerns from our students, from their families, from our educators, and from our communities about just keeping our buildings safe. Let's be honest, like everyone in this room, I'm sure, we had hoped that we would have a different outcome at this point in the game with this pandemic. All of us are eager to get past this pandemic, but the numbers don't lie, and we are not past this pandemic. Today's action absolutely ensures a safer and more successful school year by still allowing us to fight this virus. Using the tools that are available to us, such as we have already heard about masking and about having all those who are eligible to take the vaccine to get the vaccine, because everyone who gets the vaccine now helps make our schools and our communities safer. I want to be clear that our 200,000 members, NJEA is committed to opening our schools and providing the best successful school year for every one of our students. Our students deserve that. But it also means being responsible for keeping them safe under these conditions. Our commitment and our consistent voice regarding what is needed by following the science, by masking, by getting the vaccines if we are eligible, still stands today, and we are calling for that again. Again, thank you, Governor Murphy, for listening to public health experts, but most importantly, thank you for always keeping our students first.
Thank you, Marie. God bless you. So well done, as always. God bless you. Marie, thank you so much. And to all of our speakers, Dr. Valesky for hosting us. Brad, thank you as this great community's great mayor. To you and members of council, and thank you for hosting us. Dr. Jean Kraft, Janet Fike, Donna Pluce, Marie Bliston, our great commissioners, educators, staff, leaders. I'll leave you with a couple of very brief thoughts. Again, this step is not a step we take with any amount of pleasure, but we have to take it. And I hope it's not a permanent, as I said, we are all hoping it's not a permanent step. Secondly, this virus, Judy knows this better than anybody, it's humbled all of us. Every time when you think you've got a trend in sight, it goes the other way, including some cases positively. And let's hope we get some of that as well with this Delta variant. You saw that in the UK. You see India is now bouncing, which is a little less good than it was last week. Thirdly, masks got political. I don't know why, when. I think I probably can speculate as to why. But it need not be the case, folks. This is a simple step that each of us can take, kids and adults, that meaningfully pushes back against the transmission of this virus, and especially against this variant. I would just beg folks, including the folks outside who don't appear to be too happy about this, I would beg them to, A, know that we're making this decision based on the facts. There's no speculation here. And B, let's leave the politics at the door. This is not about politics. This is above politics. This is doing the right thing, and I would beg folks to see that, even if they're not happy about this. And lastly, to repeat a plea that I think all of us have made, please get vaccinated. They're safe, they're effective, they're free. And for all of the folks out there, and every day there are fewer of them who have illegitimate reasons why they're not vaccinated, there continue to be folks out there who have legitimate reasons, and we're doing everything we can. Judy's overseeing a massive community core, literally door-to-door campaign in dozens of communities around this state. There are too many folks in our black and brown communities especially, for a variety of reasons. A sordid American history as it relates to vaccines in the African American community. Folks who may not speak English. Folks who think their immigration status will be outed. Folks who think this costs a lot of money, it's free, and your immigration status is irrelevant. Folks that maybe are working 2 or 3 jobs. We have nothing but sympathy for them, Our hand is outreached. Our hand is probably knocking on their door. In fact, we want to help them get vaccinated because we know that the will is there. And for the folks who believe the myths and believe the lies, I pray for them every night that they come to their senses and they realize that these decisions, including whether to get vaccinated or get masked in school, are based on the facts. They're based on the science. They're based on the data. And we want everybody in this state, whether we agree with them or not, to be alive and to be healthy and fulfilling the promise of each and every one of their lives. With that, thank you all very much. Marie, love you.